Hi everyone. So today we'll be discussing about something called as oral habits. Sounds new? Okay. So now the question comes, what are they? So oral habits are basically repetitive habits, or I should say repetitive patterns of certain kind of behavior that involves your mouth or the oral cavity, and that involvement has got significant effects on health, specifically oral health. Now you must be thinking that what is the reason that these oral habits occur? Now basically there are two theories in support to this oral habit. Okay. The first theory, that is the psychoanalytic theory, that says that this oral habit, okay, this repetitive pattern of a certain kind of behavior that involves your oral structures or your oral cavity, that habit is because of erotic pleasure that is derived from oral stimulation. That means you derive erotic pleasure when you stimulate your mouth structures or your oral structures. And this kind of a thing, they consider it to be a normal phase of human development. But if it persists beyond the oral phase, that means any kind of this oral habit, if it persists beyond 3 years of age, then it reflects abnormality, then it reflects the inability to manage stress, or it reflects that there is some kind of stress problem that the child is going through. The second theory in support to this is the learning theory, which is a more accepted theory worldwide. Now, according to this theory, it says that this oral habit is basically an adaptive response. Okay, it's learned. Okay, it becomes a learned habit, and there's no psychological root or there's no psychological abnormality to it. Okay, but both of these theories agree to this point that if this kind of or any kind of oral habit is found in a child, that means that the child is suffering from one or another kind of stress. Okay, now comes the main thing, that what are those oral habits? So the first that I've mentioned is the digit or thumb sucking habit, or finger sucking habit, or thumb sucking habit basically. So I have made a complete and detailed, I think almost 3 videos with regards to all the aspects of thumb sucking habit. I'll put the link in the description, you can check that out. So I won't be discussing this here. Now starting on with the another habit, that is the pacifier habit. Then comes the mouth breathing habit, tongue thrusting habit. There are certain lip habits. There's something called as nail habit. Then there's something called as bruxism and self-mutilation. So we'll start and take one by one what each of these habits are. Now, the first that we'll be discussing today is the pacifier habit. That means the children who are given pacifiers to soothe them out or to make them relaxed. They're always having this silicone kind of a thing, I'm sure you might have seen, in their mouth all the time, right? And manufacturers of these pacifiers, they claim that they have developed pacifiers that are more like a mother's nipple. But the studies have failed to show this claim of theirs, and it has been seen that the pacifiers do have adverse effects if they are continued for more than 36 months of age. Pacifiers that are discontinued by 18 months of age do not have that much of adverse effects on your oral health or oral structures, but if it's taken beyond 36 months of age, can cause anterior open bite. That means you will see a gap in between your upper and lower front teeth. There'll be reduced overbite. That means there'll be reduced vertical overlap between the upper and lower front teeth, and there'll be posterior cross bite. That means the backward teeth, The upper back teeth will be inside and the lower back teeth will be outside. What these anterior open bite and cross bites mean, I have discussed all of these terminologies in my thumb sucking video. I'll put the link in the description. You can check that video first so that you will be clear with what open bite and over bite and cross bite mean. So you can watch that video for reference. So yes, pacifier habit, if continued for more than 36 months, cause these problems. So it is highly recommended that children need to be withdrawing this pacifier habit by maximum by 36 months of age. Okay, now another habit is mouth breathing habit. That means your child is breathing through mouth and not nose. Now, why does this habit occur? See, it can happen because of two things. First, the lip of the child is incompetent. That means in the resting position, the child is not able to close the lips. Okay? In resting position, there is some gap in between the lips because maybe the upper front teeth are too forwardly placed, or maybe the lips itself are short. So when the lips are not able to be closed at the resting position, that's called lip incompetence. That can give rise to child becoming a mouth breather. The second reason can be there is some nasal airway obstruction. That means there is some obstruction in the nose because of which the child is not able to breathe through nose and is forced to breathe through mouth. Either which ways, if the child continues to breathe through mouth, it will cause the lower face to elongate, because when the child is mouth breathing, obviously you can understand that the mouth is open because the lower jaw is lying down. Because the lower jaw is lying down, obviously it means it is rotated backwards. Because it is rotated backwards, obviously the lower face length is elongated. The second thing that it does is maxillary constriction. That means the upper jaw is reduced in width. Why? Because when the lower jaw is lying down, it's open, the tongue is also lying down. When the tongue is lying down, that means the tongue is not present there to combat the forces of the mouth muscles, and there's a imbalance in equilibrium. You will be able to understand all of it if you watch my video on thumb sucking. If you watch this video in continuity to the thumb sucking video, everything will be understandable and you will not find these terms confusing. So yes, these are the adverse effects that a mouth breathing habit can cause. Okay, then there's something called as tongue thrusting habit. Now what does this tongue thrust mean? Basically, this habit is a habit wherein someone has this habit of pushing their tongue forward between the upper and lower front teeth when they swallow. See, this kind of swallowing, it's called an infantile swallowing. It's normal for an infant, for a newborn, it's normal. But as you grow and become an adult, this infantile swallow, wherein your tongue thrusts forward, wherein your tongue sticks in between the upper and lower front teeth, this kind of pattern changes into a pattern of adult swallow wherein the tongue is resting against the palate behind the upper front teeth. When that does not happen and this habit persists beyond the infantile age, beyond let's say 3 to 4 years, then it can again cause open bite. It can again cause incisor protrusion. That means the incisors will stick outside, it will move forward. And also lisping. That means the child will develop the habit of lisping. He or she will not be able to pronounce the consonants and the letters properly. Okay. Then there is something called as lip habit. Now lip habits, that means any kind of habit that involves maneuvering your lips. It can either be lip pulling, wherein you keep picking and chipping off the uppermost layer of the lip. That means you keep pulling the skin of the lip. Or it can be lip licking, that means you're constantly wiping your lips with your tongue. Then there can be lip biting, there can be lip sucking. All of these lip habits can result in lip licking dermatitis. That means the skin around the lips will be red and chapped and there'll be burning. Then you will also have cracked lips. You will even have bleeding lips, and also again you will have increased overjet. That means your upper front teeth will be forwardly placed, because obviously the uh, lips, if you tuck them inside like it's shown in the picture which says lip sucking, if you always have your lips in that position, obviously it is applying forward force on the upper front teeth. So you will have your upper front teeth forwardly pushed, and that will increase the overjet. And also the lower front teeth will be pushed backwards, so that also increases the overjet. And then there'll be cracked lips, obviously, because you have your tongue uh, almost always touching your lips and causing soreness and chappiness. So all of this will be there in lip habit. Then we have something called as nail biting. And nail biting habit is usually seen by the years 4 to 6 years of age, and it increases. Yes, it increases in teens and in adolescence. So though it does not have that many adverse effects on oral structures, but yes, it can cause certain minor enamel fractures. That means the topmost layer of the tooth that you see, that's called enamel, and it can cause certain minor fractures on the enamel. So this also needs to be worked upon, and this shows that the child is suffering from some or the another kind of stress, because of which he or she is biting his or her nails. Then there's something really interesting, and it might be new to you, is bruxism. Now what is bruxism? Bruxism is basically a condition in which you grind, you gnash, and you keep on clenching your teeth. It can happen while you're awake, it can happen while you're asleep. So this child has this continuous habit of keeping on grinding their teeth and gnashing and clenching there. And the most common cause of bruxism is said to be stress. Although it can be because of many other reasons also. You can have certain interferences in between your teeth, or you can have some high restoration. That means you can have a high filling because of which you're gnashing your teeth, or there can be certain nutritional deficiencies, or you can be allergic to something. Okay, so there are many reasons to it. Any which ways, the representation of it is bruxism. That means the child keeps on clenching their teeth. And because the teeth are prone to undue pressure, it will cause multiple fractures, it will cause wearing away of the surface. Specifically, the canines and the molars will wear away, it will become flat. And also the chewing muscles, the masticatory muscles will become sore. You will have pain in the muscles of your mouth, and you will also have temporomandibular joint pain. That means the joint that you have just beside your ears in front, that will pain. Okay, so that is basically the area where your lower jaw is locked to your skull, and that will start paining if you have this habit of bruxism. So this also need to be worked upon. Then is something called as self-mutilation. That means one has this habit of deliberately altering and destroying one's own body, and that provides them fulfillment of some kind of satisfaction. Okay, and it can involve anything. Since we are discussing about oral habits, so basically self-manipulation of your oral structures. That means biting your lip, biting your tongue, biting your oral mucosa, that means your oral skin. So all of this will fall into self-mutilation. So that's it. These were all those oral habits that are still there, but people are not aware of it, that these are bad habits and they need to be stopped, and they are causing harm to your body, specifically oral health. So that's it. Yes, there are certain treatment patterns also for all of these habits, and I'll try discussing them too. Till then, take care. Bye.